On the 23rd of August 2023, my mom was being discharged from the general hospital after being hospitalized for 10 days. She went from the bed through the doors of the ward on her wheelchair, got to the car in front of the hospital, sat in the car and died. Before she passed away, she called for my dad because he was inside getting her prescription. He forgot. He came out, and by the time he got there, her eyes were already rolled back in her head. Upon getting her out of the car, they got her back inside where the doctors, I would say, pretended a resuscitation attempt because they knew she was dead. I think they were just buying time to wait out the reaction of my dad because, you know, she was just alive. She was being discharged. You just checked her. You said that she was fine. So they came out. They told him that she passed away. Moments after, another doctor came out and told my dad, no autopsy, because apparently he's God and he knows what she died from. We left here on August 2nd because my grandfather passed away, so originally we were in Grenada for his funeral. My mom had her doctor appointment, her regular checkup in July, around July 9th. She did not have any pre-existing conditions to say that she was sick or she was a sickly person. When we got there, she started having a little bit of difficulty breathing, feeling like she was going to pass out, and we thought it was the heat because at that time Grenada was having a heat wave during August, so we thought it was that until it got really bad, so she had to go to the hospital. So originally we were supposed to leave on the Wednesday. She went in on Carnival Sunday, so my dad made the decision for me to leave on Wednesday and he stayed back because we were told by the doctors that she couldn't fly. She couldn't leave. She couldn't fly commercially or by medevac, so she had to stay. And that was one of the greatest mistakes I've made in this whole situation, and one that I've regretted every day since she passed, was actually listening to the doctors, and I left her there. I returned to Grenada to do funeral arrangements. I have a lot of documents and a lot of paperwork to go through and to do because we don't live home. And that's where this whole ordeal started. That happened, and because of the grief that we were going through, me particularly, I wasn't asking the right questions. I couldn't think, I was distraught. So I couldn't think, nothing was processing until, I think after her funeral, I think that's when my common sense started to come back. I also have questions for myself, for medical history, just in case, for me to be on the lookout for anything. I've asked for my dad to get her medical chart because I just wanted to know what transpired, as well as ask for her report, get all the documents for her family doctor. My dad went to the hospital and he asked for her chart. He asked for the things and they refused to give the chart.
My dad was given her labs and a very vague report. So I started sending out detailed emails asking for a chart to the PS of the Ministry of Health, the Minister of Health, and the General Hospital, to no response. I then sent an email to the medical director. They responded, and the secretary said they will look into it. After 2 weeks, I didn't hear anything. I reached out for a follow-up. They replied that they gave my dad the report. I'm like, wait, if you're so confident in the care that you gave her, why are you denying us the chart? Her family is entitled to that. I mean, she did not even make it out the compound. She basically died at the door. So I got a lawyer, and they sent a letter asking for the chart in December. In January, the medical director responded that the executor of her estate, which is me, can get the report once they receive the document. It was sent right away. There's no response again. In February, my grandmother died. I'm back in Grenada again. This time, the lawyer sent another letter, very detailed, asking for all of the information. We want to know what was the medication, when was the medication changed, what was her dosage, how it was administered. All of it, very detailed. This time, the Ministry of Health responded in March, saying that I need to go through the court to get the chart. So I need to make an injunction or file for an injunction with a claim. Mind you, the legislation is 6 months from the time that she died to make the claim. And I perceive that the state lawyers and the medical director of the hospital were very aware of that. We only started asking questions after she was buried. We did not do a second private autopsy, so we needed the chart. And to protect the doctors, they were not releasing the chart to us.
Because she doesn't know the difference between a chart and a report, that extends the time even further until it's a year later and the lawyer discovers they're not going to give us a chart. We can't file suit, so it's something that I just have to give up. I've accepted it. At least I tried, I tried to fight for her honor. So now I decided that I'm going to tell her story. So pretty much that's what it is. My mom had questions about the medication that she was given. And she told my cousin, they keep giving me all this medication. I asked, would it start to interact with each other? And, they're saying me, oh, you're fine. We're going to give you a paper to show all the medication that you got, this, that, the other. My mom was discharged by a doctor that she never seen, Dr. C. Brown. I've called the hospital about 13 times just to find out what the C stands for. There's no registration number of the doctor on the discharge paper. Not her attending physician. Someone just come and say, oh, you're going home today. We asked, what was the examination that you gave her? You said, okay, once she's discharged, after a week and she returns, she needs to see a cardiologist. But she wasn't appointed to see one at the hospital before she left. The pathology department and the general hospital, as well as the Ministry of Health, are in cahoots. All I needed to do was just read. My mom died on the 23rd. On the report, it says the 24th. In a group of nurses and doctors, nobody could have recorded the time of death. There's no time of death on her report. The general hospital report is dated on the 28th of August. Her autopsy was done on the 31st. My dad signed on the 24th. He went there the next day to sign. And you guys said that they were about to do the autopsy that he needed to sign. On the 24th. Why is her autopsy done on the 31st of August? A lot of people are dying in Grenada, and the death certificate basically reflects what the person was being treated for. It's not independent. The pathologist is bullshit. These are the questions that we had. Make it make sense. Nothing that I can say or do will bring her back. But I have questions. That's the reason why it wasn't even about a suit. It was just about getting the answers. We didn't want to go through this. We want her alive. It's not even about that. Let me make this very, very clear. I'm not politically affiliated with anybody. I don't live in Grenada. I don't have any intention to after what I've experienced. I don't care about politics. But this current administration, you guys clearly do not give a shit about the citizens of Grenada. All that you guys are doing currently is just playing political child's play online. I never used to pay attention to this thing, but since after what happened to my mom, I started paying attention, and you guys are just like a bunch of asses. People are dying. Kids are dying at that hospital. When you have parents that are coming in there, walking in with their kids and their kids dying, and instead the reaction that you guys doing is to call security, to shoot people. I want to see your reaction if your kid die in your arms. I would love to see it. You guys clearly don't care. They lack empathy, they lack professionalism, a blatant disregard to human life. The oath to preserve human life from the doctors has now been replaced. It's almost like you have a contract with LACWA or Otway. The hospital is a death camp. This was you are aware of the problem. A couple months ago, you guys held a press conference
and vow to promptly address grievances through a complaints committee come amidst heavy criticism from the public on the delivery of services and the actions of some members of staff at the General Hospital and other medical facilities. Permanent Secretary with responsibility for strategic and operational management of the general and subsidiary hospitals, Naomi Jeremiah, says she will not make excuses for anyone. She says sorry on behalf of the Minister and the Ministry of Health.
We are not condoning any wrong. I know my clinicians here are very professional, but they may have a few who may have issues, and we want to get to the root of all the matters. So, on that note, I would like to extend an apology to all persons in Grenada, Carriacou, and Petit Martinique who at some point or the other had been felt hurt because of the actions of a few. On behalf of my minister and the management here, we are indeed sorrowful for that. And for the persons who had passed also, we had a number of unfortunate deaths. We also want to say we apologize.
Sorry.
Recommendations will be made to the relevant bodies to have answers.
This announcement also follows allegations of accidental deaths of patients, including infants, due to the actions or inactions of staff at the General Hospital.
And the most that you could say is sorry. Godless people. What are you waiting for? Are you waiting for something drastic to happen? Where blood is running. When you're playing psychological games on people, somebody is going to have a mental breakdown. They're going to have a psychotic break, and they're going to kill the wrong person, and a family member is going to go in there and they're going to wipe out all of them. And I guess that's when you guys, the ministers and the prime minister and everybody will now come and hold a day of national prayer. When you guys refuse to act. What would it take for you to act? You have senior nurses going to the media outlets to actually talk about the deplorable situation that is happening. It is an ongoing state of emergency that is happening at the hospital. I don't understand how you guys sleep at night. I don't understand it. We can light up the carnage with this shitty ass lights and put up a 500 drones show in the sky. And the hospital doesn't have an ice pack. My mom has closed veins and they having to poke her multiple times. Her arms were black and blue. They putting ice in the gloves to put on the hand. No ice pack in the hospital. My aunt decided she got 2 for her, write her name on them, brought it in there. It's in the freezer. Next day, she comes in, ice inside the gloves. She was like, no, I bought 2 ice packs. Where are they? First nurse gone. They don't have no ice pack here. She said, no, I brought it yesterday. You don't have no ice pack. I don't see no ice pack. If you know my auntie, she won't take no for an answer. She gone back the third time, the ice pack come back, the ice pack melted. Ready to walk out the hospital with the 2 foot.
The mindset of some people and the level of incompetence, the level of stealing taking place in the hospital. The more you buy things, the more they steal. It's a fact. And sometimes we don't like to talk about that at different levels. Not one set of people. We got doctors doing it, we got nurses doing it, we got orderlies doing it, security people doing it. The more meat you buy, more meat disappear.
Kid does lie, but he didn't lie this time. There's nurses and doctors, they hate their jobs. They hate it. They don't like people. And the ones that are there that are good, they're frustrated. My mom was hospitalized on Carnival Sunday. The nurses in the back, they're more on their phones talking about what somebody wore at an event. Who they in party and what they're wearing and what they're dressing, what they have on. And you're in the hospital. When I just moved here, I was working at a bakery. I wasn't allowed to have my phones. But you have a nurse on an active ward giving people medication and everything, and you could be on Instagram. You could be on Facebook. There's no protocols, there's no policy at the hospital. You have a policy for visitation that you can't allow kids. You know you're killing the people. At least allow people to see their grandchildren and their kids, because they may not make it out alive. My son wasn't able to see my mom. She wasn't allowed to see him. Well, some, because after a few days later, my dad saw a child in there. But children not supposed to be in the ward, right? So I guess it's who know who. You guys don't care about the mental state of your patients? You have people who grieve because they couldn't see their kids, can't see their grandkids. Who's running the schedules? You go in the hospital, there's no doctor. One technician to operate the CT scan machine. One technician, and he was on vacation. They had to call him, and thank God, I don't know what they said to him, that he decided to come in to do the scan. So what happens if something happens to him? If he have a sick day or something like that? People are scared to advocate for their family members. They're scared of the retaliation of treatment once they leave for their loved ones. When they were serving the food, she was asleep. When she got up, it was cold. So my cousin asked, okay, nurse, could you warm this for me? She wasn't sleeping. That's okay, but she was asleep, but that's fine. Could you just warm the food for her? Oh, you can't put foil in the microwave. Jesus. Another one was dealing with my mom aggressively, and my mom had to tell her, you know what, I did this job for a certain amount of years. My mom worked at a hospital setting with RNs and doctors on an everyday basis for the last 14 years. If you don't know how to do it, let me show you. If you don't know how to maneuver, let me show you. I can help you. And until she spoke, like she told her, then that's when she started to come down. Oh, I wasn't roughing you. Girl, if I only get to know you, Pigs, because they hate their job. They hate their job, and they're only doing it for a paycheck. You cannot walk in the health department and hate people. You can't. You're scared to tell the nurse this, you're scared to tell the nurse that, because you're scared now the nurse is gonna be aggressive with the patient once you leave, once visitation is over. Because you guys in the ministries and you politicians, you Dr. Taisha Donald, the reason why you guys are comfortable living because of the way that you guys live your prominent lives, that you're able to run when time comes to run. You're able to leave to get medical treatment whenever you can. But the regular citizens of Grenada cannot. They can't afford to jump plane and to go anywhere. They can't even afford for funerals. $16,000, $17,000 to bury somebody. Who could afford now to go to a lawyer to actually come and say, okay, this is the case. My child died because of negligence. Who could come after you guys after you had to go and spend all that amount of money for a funeral that you wasn't prepared for? You guys are counting on that. If a regular person like myself could come and sit down and you draw out a plan, these are the current issues that you're having. These are what we could attempt to fix now. Rome wasn't built in a day, but you could attempt to start laying brick by brick until you build something that works. The healthcare is the most important sector, just as tourism, just as agriculture, just as everything else. Healthcare is supposed to be at the forefront. The system just needs a complete overhaul. You guys have money to do every other thing. We have regional partners all over the place. We could beg whenever we go anywhere for money for this, money for that. Who's begging for the hospital? Instead, you guys talking about building another one. Building another one when the current one is a death camp? So you're just moving the death camp from one location to the next? They put it out because they wanted the bed, right? Saying that my mother was a saint, but at the end of the day, she was my mom, and she didn't deserve to die like that. You guys are just mere men. There's a God that is above you guys. The last thing that mother said before she died, because this was her third child that she buried, she said, whatever falls in her pot will fall in yours, because it's coming. It's already started. I don't wish bad on anyone, but you do not know the despair and the grief and the turmoil and you don't know what we've been through as a family. You have no idea, and nor do you care. So that is the story of my mom. It's not her life story, because you guys did not know her. And I'm gonna leave it with my cousin's poem. It gave a little description of who she was as a person.
T represents how tender-hearted and thoughtful she was. H represents her humility and helpfulness. E describes how elegant she carried herself. R, being a rational thinker. E, whenever she comes, her energy fills the entire room. S, always wear a stunning smile. A, amazing personality. The name we all called her, Kuli. Her calm personality. Very open-minded, very observant, lovable, intelligent. Most importantly, empathy that carried her through her career.